Hey everyone, and welcome back for another deep dive. Today we're tackling a topic that you specifically requested: capillary refill time, or CRT as it's commonly known.
It's a great one to delve into.
You want the doctor-level explanation, especially when it comes to its reliability.
Yeah.
And luckily, there's some recent research that does just that.
You know, what's so interesting about CRT is that it's such a fundamental part of our exam. We use it all the time.
Right.
But there's always been this question mark hanging over it in terms of, how reliable is it really? And this new study in JAVMA really tries to tackle that question head on.
Okay, so before we get into the nitty-gritty of the study itself, can you give us that, doctor-level rundown of what CRT is and why it even matters in the first place?
Sure. So CRT, or capillary refill time, basically measures how long it takes for the color to come back after you press on the gums, typically. You're assessing peripheral perfusion.
Yeah.
Which is just a fancy way of saying how well the blood is flowing in those tiny blood vessels.
Wow.
So in a healthy animal with good perfusion, that color should return pretty quickly.
Right.
Usually less than 2 seconds in dogs and cats.
Right.
If it takes longer than that, it can be a sign that something's off with their circulation.
So this JAVMA study, what exactly were they trying to find out about CRT?
They really wanted to know, is CRT reliable? In other words, if different people measure it, or even if the same person measures it multiple times, will they get the same results?
Right.
Because if a test isn't reliable, it's not really that useful, right?
Makes sense.
Mm-hmm.
So how do they go about testing the reliability of CRT? What did their study actually involve?
So they took 20 dogs that were presented to an emergency room.
Okay.
And they had 2 very experienced veterinarians who were trained on a standardized way of measuring CRT.
Okay.
Measure each dog's CRT 3 times. They even used a stopwatch to make sure everything was super precise.
Wow. That's dedication to detail.
They really wanted to minimize any potential inconsistencies in the measurement technique.
So it sounds like they set up a very controlled environment to really get to the bottom of this. What did they find? Were the measurements consistent?
The results were pretty compelling. They found that there was both high interobserver reliability, meaning each vet was consistent with their own measurements, and high interobserver reliability, meaning the 2 vets agreed with each other as well.
Now, that seems like a good sign for CRT, right?
It definitely suggests that when you do it right and you do it consistently, CRT can be a reliable indicator.
So consistency is key. Can you break down some of the specific findings? I know they used a couple of different methods to analyze the data.
They looked at the coefficient of variation, or CV%, which essentially tells you how much variation there is in the measurements.
Okay.
So a lower CV% is better because it means there's less variability.
Right.
And both vets in the study had a CV% of less than 10%, which is considered very good.
Okay, so low CV% is good news for CRT. What was the other measure they used?
The interclass correlation coefficient, or ICC.
Didn't you say that ICC measures agreement? How is that different from CV%?
You're right, it does look at agreement, but in a slightly different way.
Yeah.
CV% focuses on how spread out the data points are. Think of it like, how tightly clustered your arrows are on a target.
Okay.
A lower CV% means they're all close together, even if they're not right in the bullseye, whereas ICC looks at the overall agreement between the measurements.
So regardless of the spread.
Exactly. Are the arrows consistently landing in the same area?
Gotcha. So what did their ICC values look like?
Really good. They were above 0.9 for both the intra and interobserver reliability.
Okay.
Which again points to a high level of consistency.
Sounds like CRT is passing the reliability test so far. Was there anything else they looked at?
One more thing, they calculated something called the minimal detectable difference, or MDD, which tells you how much a measurement needs to change before you can be confident it's not just random variation.
So a small MDD would be ideal, meaning you could pick up on even subtle changes.
Exactly. In this study, the MDD for interobserver measurements was 0.3 seconds and 0.34 seconds for interobserver.
Okay.
So basically, any change larger than about 1/3 of a second is probably a real change, not just an error in measurement.
So it seems like this study is saying CRT is pretty darn reliable. Does this research kind of put an end to the debate about CRT's reliability?
It definitely provides strong evidence that CRT can be a reliable tool, especially when a standardized technique is used.
Okay.
But like with any study, there are limitations we have to acknowledge.
Okay, that's important. What were some of the limitations of this particular study?
Well, one was the sample size. 20 dogs is a decent number, but a larger study would give us even more confidence in the findings.
Right.
Also, these were all dogs in an ER setting.
Okay.
So we can't be absolutely sure that the results would be identical in other populations of dogs?
Right. So more research is always a good thing, but this study gives us a solid starting point. For someone trying to understand how much faith they can put in CRT, what are the main takeaways? What does this all mean?
I think it really highlights the importance of technique and consistency. If you're using a standardized approach and you're doing it the same way every time, you can feel more confident in those CRT readings.
So the how matters. It's not just about glancing at the gums. It's about the specifics of how you apply that pressure, how you time it, all those details.
Exactly. And that leads to a really interesting question. This study focused on dogs using a specific technique. The burning question is, could the same be true for other species? And how much does technique impact reliability across the board?
That's a great point. We can't assume that what works for dogs will automatically translate to cats, horses, or any other animal.
Exactly.
All right, well, that brings us to the end of part 1 of this deep dive into CRT. Join us again for part 2, where we'll explore those lingering questions about the lack of a gold standard and what it all means for the future of CRT.
It really does. And it also raises the question of technique, right? I mean, this study used a very specific method, but there are variations out there. Does that make a difference?
So lots more to research, but I guess the takeaway for now is that vets need to be very careful, very meticulous about their technique.
Absolutely, because even small inconsistencies could skew the results, especially when we're dealing with such a short time frame, a couple of seconds.
Right, those fractions of a second really matter.
Okay.
The study also mentioned something that caught my eye, the lack of a gold standard for CRT. Can you explain what that means and why it's an issue?
Right. So a gold standard basically is like a perfect, foolproof way of measuring something. It's the ultimate reference point.
Okay.
But for CRT, there isn't a perfect alternative that we can compare it to.
So even if we know that our CRT measurements are consistent, how can we be sure they're actually accurately reflecting what's going on with perfusion in the body?
That's the crux of the matter. Without that gold standard, it's hard to definitively prove that CRT is measuring perfusion accurately. We can show that it's reliable, but not necessarily perfect.
That's a bit unsettling, isn't it? Even if we're getting consistent results, there's still this element of uncertainty.
Yeah, it's true. It doesn't mean that CRT is useless.
Right.
It's a valuable tool, but we have to be aware of its limitations. We have to use it wisely, along with all the other information we gather from the patient.
So it's one piece of the puzzle, not the whole picture.
Exactly. Always got to look at the big picture.
Now, the study also mentioned that some dogs had less reliable CRT measurements than others. Did the researchers have any insights into why that might be?
Unfortunately, they couldn't pinpoint any specific factors that consistently explain those differences. It could be individual variation in the dogs themselves,
Or
maybe even tiny variations in technique that weren't obvious.
So even with a standardized approach, there's still some degree of individual variation that we just have to account for.
Yep, that's biology for you. It's complex.
Speaking of technique, this study used a stopwatch to measure CRT, but in practice, I imagine a lot of vets just kind of estimate it visually. Any thoughts on that?
Yeah, it's a good question. And while this study didn't directly address that, there's some research in human medicine that suggests that visual estimation of CRT can be quite unreliable, especially compared to using a stopwatch.
So eyeballing it might not be the most accurate way to go.
Probably not. Using a stopwatch is likely going to give you more consistent and accurate results, although, of course, more research is needed in vet med specifically to confirm that.
Makes sense. If you want to be as precise as possible, a stopwatch might be the way to go.
I think so. It takes out some of that human subjectivity.
Now, I've heard a bit about automated CRT devices. Are those starting to catch on in veterinary medicine?
Yeah, they're definitely being explored. There have been some promising developments. Devices like the Descartes 2, for example, have shown good correlation with human-measured CRT.
Okay.
And good reliability in the studies that have been done so far.
So those devices could potentially offer a more objective, standardized way of measuring CRT.
Potentially, yes. But it's important to remember that they still have their limitations. Like, they can be affected by things like ambient light or the size of the patient, which could introduce some variability.
And of course, we still have that issue of the gold standard, which makes it tricky to truly validate the accuracy of any CRT measurement, whether it's by a person or a device.
Right. More research needed on that front.
Let's circle back to those statistical measures they used in the study. Can you give us like a crash course on CV%, ICC, and MDD?
Sure. So CV%, or coefficient of variation, tells you about the spread of your data.
Okay.
Imagine you're shooting at a target.
Right.
A low CV% means your shots are all really close together, even if they're not in bullseye. That's precision.
So it's about how consistent your measurements are, even if they're not necessarily hitting the true value.
Exactly. ICC, or intra-class correlation coefficient, is more about agreement between measurements. So a high ICC means your shots are all landing in a similar area, even if that area is not the center of the target. That's consistency and reproducibility.
So both CV% and ICC are looking at consistency, but from slightly different angles. One is about the spread of the data, the other is about the agreement between the measurements.
Right. And then we have MDD, or minimal detectable difference, which is kind of like threshold for meaningful change. It tells you how much your aim would have to change before you can be confident that it's not just random chance.
So in the context of CRT, a small MDD means we can be more confident in picking up on even subtle changes in perfusion.
Exactly.
Okay, so taking all these statistical measures together, it seems like they paint a pretty convincing picture of CRT's reliability in this study.
They do, and that's what makes this research so important. It provides solid evidence that CRT can be a reliable tool, but as we've talked about, it's not a perfect tool.
Right.
We have to be aware of the limitations, the nuances, and the need for more research.
It sounds like there's still a lot to learn about CRT, but this study definitely gives us a good foundation to build on. It's fascinating how something like CRT, a test we use so routinely, can have so much depth to it when you start to really dig in.
It really is. It's a great reminder to always stay curious, right?
Yeah, even with things that seem basic. We've talked a lot about the technical side of CRT, but what about the bigger picture? How does all of this relate to providing the best possible care for our patients?
Well, I think this study really drives home the importance of being thoughtful clinicians, really paying attention to the details.
Can you unpack that a bit?
Yeah.
What do you mean by thoughtful clinicians?
It's about recognizing that those seemingly small details, whether it's how we perform a CRT, how we interpret the results, or how we combine those findings with the rest of the clinical picture, those details can have a big impact.
So it's about being very deliberate and mindful in every step of the process.
Yeah. And it's also about being humble, recognizing that there's always more to learn, and being open to refining our techniques as new evidence emerges.
That's a really important point. Even for those of us who've been in practice for a while, there's always room to grow.
Definitely. And this study also highlights the need for more research to fill in those gaps in our knowledge. Exploring CRT in other species, looking at the impact of different techniques, and of course, the quest for that gold standard.
So a call to action for the veterinary community to keep pushing the boundaries of what we know and striving for the highest quality of care.
Absolutely. That's what it's all about.
Well, I think we've covered a lot of ground today, learned a lot about CRT. Any final thoughts for our listeners as they go forth and assess those capillary refill times?
I would say remember that CRT is a valuable piece of information, but it's just one piece. Don't get too hung up on the number itself. Look at the whole patient, consider the context, and never stop learning.
Great advice. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.